Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Now, before we get into today's episode and our amazing guest, a quick note from our sponsor called Growth Solutions. We are your growth partner for busy health and wellness professionals. We work to eliminate the biggest headaches that you may encounter, whether that's tech overwhelm, whether that's lead of new patients coming in the door, lack of patient communication. We want to make life easier for you so you can enjoy practice again and enjoy practice when you're away from it. So if you've ever said this to yourself, I'm way too busy to grow, I'm too slow to scale, or I'm too overwhelmed to fix it, we can help. If that feels like you, just drop the word grow and below into the chat. We'll get back to you. You're welcome to send me a message on LinkedIn. Now let's dive into today's episode and our amazing guest. And I'm really proud to introduce Dr. Vidal Sheen, a board-certified physician in internal medicine and phlebology, and a recognized leader in varicose vein treatment, aesthetics, longevity, and regenerative medicine. Dr. Sheen is also a certified registered vascular technologist and a registered physician in vascular interpretation, bringing advanced diagnostic expertise to his comprehensive vascular care. He is the founder and medical director of Sheen Vein Aesthetics and Functional Medicine, a practice dedicated to combining functional and regenerative medicine with advanced aesthetics treatments to promote true healing and optimal wellness. Now, with over 2 decades of medical experience and the past 5 years devoted to pioneering regenerative therapies, Dr. Sheen has helped hundreds of patients restore their appearance, vitality, and health from the inside out. Now, in addition to his clinical work, Dr. Sheen serves as a regional speaker for Fontana Laser Systems and is widely known for his educational blogs that cover a range of topics in aesthetic medicine, functional health, and regenerative care. Dr. Sheen, I want to welcome you to the Prime Health Podcast.
Thanks, Derek. Thanks for having me. Whatever I can do to help people understand healthcare, health and wellness, whatever it might be.
Love it. Well, we'll dive into that because I know you, with your bio, you're loaded with information. So I always kind of love starting this off as the first question. Was there something in your life when you were younger or as you were, growing up that said, my path is in healthcare? What made you make that shift?
That's funny. Actually, my path wasn't in healthcare. My background is actually in bioengineering. And so when I was about to finish college, I had the option. I had an actual engineering job, or I could go to medical school because I had the background for that as well. So I just said, hey, let's just take the MCAS, take whatever it is and see what happens. So it turned out I had both options. And my mindset was the medicine side was funner for me. I looked at it as, okay, do I want to be 50 years old and be an engineer? And it's like, okay, am I going to be really good at it or not going to be good at it? Didn't really know. But the medical side of it, because all my siblings are on the medical profession in one form or another, it was sort of a logical step as far as that goes. I don't regret it at all.
Okay, love it. What made you decide to really focus on the vascular part of medicine?
That's interesting as well, because I did internal medicine for a while. It became lifestyle, honestly. It's I was working pretty much every day, most of the weekends. And it was right around the time my daughter was born where I realized if this continues, I'm never going to be at any of her dances. I'm never going to be at any of these events. That's more important to me. Family is more important at the end of the day. Because people never, even like Steve Jobs never says, like, his main regret was never spending time with his family or spending as much time with his family. And I don't want to have that regret.
Yeah. Well, you were smart to do that, I'm sure. So then tell us a little bit about how the vascular part of, how that practice has gone. And then there's been this shift, as you said, in the last 5 years of slowly getting into functional and regenerative medicine.
Well, I mean, I've been in vein business for probably almost 20 years now. And I think the problem is most people from a vein perspective, most people are misled. The mindset of vein problems is that most people assume it's a cosmetic problem, when in fact, in reality, even if you think about, say, like a spider vein is really, it's a tube that carries blood from point A to point B. It's a vascular problem. It's a circulation problem. So whether it be a ropey vein or what they call a greater saphenous vein or spider vein, there's a defect in it. And unfortunately, it carries such cosmetic stigma. And as a result, insurance companies are unwilling to pay for it. So over the years, the willingness of insurance companies to cover this or cover that has become less and less and less. And I think physicians see that across the board, and not just in vein stuff, but just in general. So during that time, I got more and more involved in just trying. It always fascinated me as far as how medical care really wasn't going anywhere. And what I mean by that is, just like what's highlighted now, everything is chronic. Everything's a chronic disease. And when in fact, when you start to really sit back and you look at it, and when it really got into all the functional type medicine, you start to realize we're not treating the disease, we're just treating a symptom. I'm sure you probably heard that as well. So as I delved into it, I realized, my God, even as an internal medicine person, I know nothing. I know nothing. I know the physiology, I know things like that, but the depth of knowledge you need to have or the approach you need to have to be able to be a really good functional medicine doctor is at another level. You got to, instead of just thinking about a symptom, you've got to start thinking about what's happening on a cellular level, what's happening from an inflammatory perspective or whatever it might be. And that made it really fun, because now it clicked in my mind as far as, okay, if you have this chronic medical problem, can you fix it now? That's how I got into this business.
Yeah. So the engineering mind came into play, that you can put switch A to switch B and the answer as to how that goes. But in medicine, from when you first started in it, you were treating the person and the symptom that they said they had versus maybe looking at the root cause. And I think that's where functional medicine goes, is it's, tell me what's going on. So much is given to me from the story you tell. But to get to the root cause, we've got to dive deeper and find out, okay, what's working from a systems approach inside your body. Would you agree with that?
I would agree with that. I think you really see the fact that, like, even if you look at medications, you look at it, if you understand how the medications actually work, they're not targeted towards the underlying root cause. They're targeted towards what's going to mask the symptom. And that's why, when you take chronic or an acute symptom and you just Band-Aid it, like, again, treat it with a medication for a symptom, it becomes a chronic problem over time. And when because you never really actually alleviate or eliminate what's causing it. And that's what we're seeing now. That's what we're seeing in medical, in the medical arena, just in general. Everything's a chronic problem. Like, not to date myself, but the reality is when you start to sit there and think back, like when I think back in residency, I remember one time I saw someone who had actually what turns out to be a gluten allergy. And at that time, it was basically, hey, everyone come over, come see it, because no one's ever seen it before. Whereas now it's like all over the place. Your tables, in schools where they set aside, you have this allergy, that allergy. You never saw that when we were growing up, because it really, not that it didn't exist, but it definitely wasn't as prevalent as what it is now by any stretch of the imagination. Everything's climbing. You look at, even heart disease is climbing, Alzheimer's is climbing, all these neurological diseases are climbing. Everything, we're not doing something right.
Yeah. So when patients are coming into your office, and I'm sure you see a multitude of different, conditions that come in, but how would you say, if you took yourself from being the physician you were when you first started, how has it changed as to how you treat that person from a whole body perspective within the functional and regenerative side of practice?
What's sad is that when you think about regular internal medicine, okay, so say you have high blood pressure, you come in with high blood pressure, you come in with high cholesterol. It is basically, here, take this pill it might be a selection of whatever pill it is, but basically is take this pill to drop your blood pressure, take this pill to lower your cholesterol. Whereas my mindset now has literally become, okay, you've been normal for 40 years. Okay, now all of a sudden your blood pressure is climbing, your cholesterol is climbing. What changed, right? Because Because innately you can assume that since you've been normal for 40 years, your biological system is normal, right? It's not like, hey, you were born at 5 years of age, you had ultra high cholesterol numbers. There's something wrong with your system, right? Something wrong with the motor. Can't fix that. So you're probably going to take medications for the rest of your life. But if you sit there and you've been 40 years old, nothing changed, that everything was normal, and all of a sudden I started changing. If you can, in my mindset, if you can figure out what changed, you probably can reverse it. And that's true. I mean, we're finding a lot of success as far as reversing, getting people ideally off of blood pressure medicine, off of cholesterol pills, all the things that people are looking for as far as they don't want to take the medicines anymore, because all they do is they take the medicine. Okay, maybe it drops their blood pressure, maybe it drops their cholesterol numbers, but then they start having this side effect or that side effect. It's not what you want, because when you do take these medications, you're altering a chemical reaction in your system. When you alter that chemical reaction in reality is not going to be unique to that one thing. It's going to be replicated into other systems within your body, and those are your side effects. And so the way I look at it is my mindset has evolved again over the last 5 years or so, where anytime I can activate your body's natural mechanisms, in my mind, I can never go wrong, because your body will regulate itself appropriately, because your body's again, going back to like that engineering mindset, your body is a bunch of control systems. There's a backup system, there's a regulator for every single thing it does.
Yeah. It's interesting that you have the ability to bring it back to the engineering. And I think that really does help, because that helps you re-engineer the thought process. Like, as you're saying, when a patient hasn't had a problem, when they turn 40, they do. Let's look backwards in time, the last month, 3 months, 6 months, to find that. And I'm sure your engineering mind enjoys that trip back in place to try and find that. And then it makes the patient think a little bit. And then your ultimate outcome is you're trying to give them a better quality of life instead of just a pill. And I'm not saying you should never give a pill, and I'm sure you aren't saying that either. There's a time and place for both of them, but you need the best outcome for that patient for a long-lasting lifestyle.
Exactly. And actually, when I talk to patients, a lot of it is education, right? I mean, it's, if I'm sitting there as a physician, it's really all about communication between you and as a patient and myself, because I can tell you whatever I want to tell you, but if you don't believe what I tell you, or you don't understand what I'm telling you, and you don't take the leadership of your own health in terms of, doing what we're guiding you on, it doesn't go anywhere. You have to be the advocate for your own health, and you may think, okay, the physician's there to help you. They are there to help you, but they're not going to be the advocate for you, where they're going to hold your hand and do all this for you. You have to. That's why, I mean, when I do my functional consults and visits, everything's about education. Okay, I'm changing this, and this. But I want you to understand, though, why I'm changing this, and this, because there's a reason why I'm changing it, because it's going to affect, this thing or that thing. And that's what's going to help your body work better or function better or help eliminate this symptom or that symptom.
Yeah. Is there a mix? Well, there is a mix, but what's the mix in your practice of the vascular aspect from the veins to doing the regenerative and the functional medicine in your practice?
So I'm still actively growing my functional practice, because I mean, even though I've been in it for about 5 years, I haven't really honestly been offering it for that long, purely because of the fact that, again, going back and thinking about how I processed information from an internal medicine perspective in the traditional medicine sense versus what true functional medicine actually is, it's a complete 180 degree. There's certain aspects of functional medicine that we don't even think of or think about or haven't thought about since medical school, because you don't think about it on that at that level. I'm thinking about the Krebs cycle. I'm thinking about all the different chemical reactions, or how this protein affects this or this. We don't think about that in modern medicine, because it's not even on your radar. So that's why I'm a big believer, and I don't like to offer services that in my mind don't work. And since functional medicine was sort of a new entity for me a few years back, I didn't, in my mind, I hadn't sold myself on, okay, does this really work? Or is this something that's sort of like a charlatan type of thing, where I'm just sort of throwing some voodoo medicine out there? And I've come to the conclusion that it's not. I'm starting to see all the flaws, all the kinks, all the defects in everything that we do traditionally in medicine. And I'm always thinking, someone mentions to me, hey, I have this problem or that problem, I'm thinking, oh my God, you can fix that. You can fix this. What if you did this? What? And I like to mix technology in with it, because I use, the scientific side of technology to sit there and help me too. It's not just like some people, when you look at like functional doctors, some people look at it as, okay, it's purely about giving you supplements or giving you whatever it might be. It is partly that, but it's also understanding how other things work, how, say like Alzheimer's, right? Now, most people think, again, it's all about what they call the beta amyloid plaquing in the brain, or the tau fibers. That's part of it, but that's what actually ultimately causes the damage. But what you need to be asking yourself is, what causes it to accumulate? And if you can eliminate that accumulation, you can, in theory, mitigate the Alzheimer's disease, or minimize the progression of it. So yeah, it's a different mindset, a completely different mindset. That's why I didn't offer it I really only offered about the last year or so. So to answer your question, probably about 80-20, somewhere in that ballpark now, about 80% vascular and 20% functional type medicine. But what I foresee down the road is the functional side will grow and grow and grow.
Yeah, I love it. Well, and the truth is, somebody that's a physician like yourself that has come from the internal medicine, you have that working behind you, that it's always a backup. There are some people that are just getting into functional medicine, regenerative medicine, because it's the thing to do. But you're coming from where, and I don't want to say you've had failures, but you've had struggles with certain patients, and now you can look back and say, hey, when I worked with Derek, I could have done something different with him had I taken on this functional medicine approach. And I think that that's great, and how that's probably how you're progressing within the practice.
No, I would agree. Yeah, I mean, it's the number of different options that you can do, and then understanding what potentially is causing this or causing that, things that we never addressed before. That's where you start to fix the things. That's where it gives me a burst of that extra adrenaline as far as it goes, because when I talk to people who are like sort of what we would have viewed as train wrecks in the past, it's like, my God, this is actually going to be pretty fun, because I can fix this, and sort of go down the line.
Yeah, that's great. How do you blend regenerative therapies in the practice with aesthetic treatments to, I guess, give yourself or your patients a better natural looking rejuvenation?
So, I mean, most people, when they talk about function, like aesthetics, right, they're thinking Botox and fillers. That's because you see the ads on TV every single day, right? So, but the reality is neither of those two products, for the most part, actually target the underlying mechanisms that lead to or cause the aging process. Because the aging process is really, to some degree, you can look at it as the loss of volume to the skin, which is typically made up of bone structure, muscle, fat, collagen. And neither Botox nor fillers really replaces that. And so when I'm talking about regeneration, I'm talking about rebuilding the collagen stores. I do liposuction type stuff, so I can use fat transfers to the face and things like that. So you actually use your own autologous fat or whatever it might be to actually volumize you. So unlike a filler where it's going to last 8 months or a year or whatever it might be, this could last 5 to 10 years, and it's all your own stuff. And it's not one of those things where, hey, your body's going to reabsorb this. Although we know now that for a lot of fillers, that's not really the case anymore. They know that your body's really not reabsorbing it the way they think it is, or the way they were advertising it as such. So I do it that way. So I look at it as, I'd rather regenerate your tissue than to sit there and give you an artificial product. Now, that being said, now as I merged in the functional side of it, you start to realize, again, you are only as good as what's on the inside. And so a lot of things are, in my mind, are not actually what people think are age related. And what I mean by that is, I read somewhere many years back that the human body, if you analyze it from an engineering perspective, it should last about 140 years. And you think, okay, why are we breaking down at 40, 50, 60 years of age? It's because your body's not functioning optimally. And so so if your body's not being given all the necessary components to operate or function at an optimal level, you will see that as an aging process, right? So if you think about your body as being, and I explain this to patients this way, your body is a complex collection of thousands and thousands of different chemical reactions. every chemical reaction, every enzyme reaction requires what they call a cofactor. It requires something to make it run. And so if you think about what that cofactor is, for most people, it's some type of mineral, some type of vitamin, some type of something along those lines that you normally would try to ingest or take in, or your body would make. And if you're deficient in those, even if that chemical reaction can go at 100%, say that that cofactor is only at 50%, that chemical reaction will only go at 50%. So if you're related to aesthetics, if it's like, say, your collagen, instead of making collagen at 100%, you're making it at 50%. So you can imagine over the years how it's going to reflect in terms of in your skin and in your, tissue or how good your tendons are, ligaments are, connective tissue, all those types of things are. That becomes the aging process.
Okay. So when you maybe first started doing some of this again, Dr. Sheen, you would do some aesthetics or cosmetics, essentially somebody requesting that from a facial perspective. And then as you've advanced and learned more, then you're doing the same thing, but adding the functional approach so it lasts longer, it holds better, it looks better over time.
That's what I encourage people to do. Now, what I found out about,
you want to do that, whether they want to themselves or not. That's got it.
Because you realize some people, as it got into the functional stuff, you realize some people are willing to listen to that. Some people are not, right? Some people are much more. I follow only the traditional medicine, and other people are like who are looking for alternatives. They're more than willing to listen and learn from you. But there is a subset of people where they just started talking to them that they'll never follow those guys, what you're asking them to do, because they want they believe in the traditional medicine aspect, which is fine. That's okay. But they don't, they're not really going to go to that level where I'm going to really try to optimize certain things because they will never follow through on it. So I don't think it holds true for everyone. I think some people, you have to be the right person of the right frame of mind to sit there and benefit from functional medicine. Because if you want to battle or accept only what your traditional primary care doctor is offering you, there's not much I can offer you because you don't want to. I'm just fighting this drug versus that drug.
Yeah, they've got to be open. You can give them the keys to the car, but they've got to be willing to get inside, turn it on, and drive it. And that driving it's different than driving in the car and riding in it. They've got to walk the walk of getting healthier. You're giving them those options. They've got to walk the walk.
Exactly, and you said it better than I did.
Yeah, you said, I'm just recapping. So what do you think are, like, when patients come in, you spoke about it a little bit, what are some of the misconceptions that you feel and experience from patients in regards to looking at anti-aging and implementing regenerative and functional medicine? So what are those misconceptions that you experience?
Well, like one of the biggest misconceptions is, how many people suffer with knee problems? Obviously a lot of people. And again, I'm not talking about, you tore an ACL, you did things like that. But the reality is that, say you just have garden variety arthritis, that's just bone on bone now, because you hear that term all the time. What's the normal protocol? Okay, I'm going to give you lubricant type injections. I'm going to give you steroid injections, maybe oral, anti-inflammatory medications, all that until basically it doesn't work anymore. And then you go towards a knee replacement. And if you talk to pretty much almost every orthopedic surgeon, they'll tell you that's what needs to happen. When in fact, the reality is if assuming you don't have ligament tears and things like that, you can, in reality, rebuild your knee. The limiting factor is you have to understand the cartilage has a very limited blood supply. So any type of healing process is limited by blood flow. And so when you talk about cartilage, you're talking about the chondrocytes and everything else within your bone structure making the cartilage. But where's your blood flow? It's passively through the bone structure. So you don't have this big whopping artery feeding into it that's going to provide all the building blocks, everything else at an accelerated rate. You're just not going to have that. That's why, when people sit there and they tell me, oh yeah, I had a stem cell injection into my knee. It helped for a little bit, then it went away. Well, why do you think? It's because you never actually gave your joint time to regenerate. The healing process takes time. And just like when you have a cut, it doesn't heal in 10 minutes. It heals in a week or whatever it might be. It takes time for your body to actually rebuild and restructure, repair the tissue. Cartilage takes even longer. that's why, like, even for us, when we do like a what we call a knee rejuvenation program, where basically over a period of a year, I start to rebuild your knee, and I use a combination of blood products and laser therapies to stimulate cartilage and tissue regeneration. So if I can sit there and I can stimulate your cartilage within your knee to enhance whatever production it can do, and then I start putting building blocks in there with blood products and promoting neovascularization and all those types of things, along the way, you'll start to eliminate or improve the knee as far as that goes. And we have found a lot of success with that. It's just a arduous type process. It's a commitment on the patient's part, but at the end of the day, I haven't had one that has required a knee replacement. They don't need physical therapy. They don't need anything. They just basically, I just tell them, okay, let's do this and go walk. Because you need the tension on the cartilage that you generate to heal, to harden. And so that's why doctors will tell you, hey, they try to grow cartilage, and they've grown cartilage in a petri dish before, but the cartilage is of low quality. It's because you need, just like, again, going back to the engineering side, you need tension, you need stressors to put to harden it. And that's the walking side of it. And when it's in a petri dish, that doesn't happen.
We talked about this before the show started with my wife experiencing some knee discomfort. So we'll see what she says, and then maybe I'll have a conversation about what some outcomes could be for us doing something different. We're a little too far away where we live currently, but we'll see. Maybe we'll come visit someday with her.
Definitely.
A question for you is, what's your thought on how the metabolic dysfunction issues that are happening, like insulin resistance and inflammation, how is that affecting people, and how can regenerative and restorative medicine help that person?
Unfortunately, you're breaking in and out now. Could you repeat that?
Okay. So, yeah, I can do that for you, Dr. Sheen. My question is, from a metabolic standpoint, people that are dealing with insulin resistance or have chronic inflammation, what is it that you offer from a regenerative medicine side or the functional medicine to help improve their life?
Well, I mean, insulin resistance probably is one of the most common things that you find in society. I mean, it's really what, in my mind, one drives obesity to some degree. I mean, it's an end result. It's a result of obesity to some degree, but it's also a result of how you eat and how the society actually is. Because when you really sit back and you think about when we were hunters and gatherers, did we really eat at 6 a.m, noon, 6 p.m., snack, and do all those things? We didn't do that. We ate whenever we, were able to catch an animal or hunt something. So you definitely would have periods of fasting. And what we've started realizing in the functional arena is that fasting period is actually critical to some degree sort of longevity in terms of making your body function properly. But at the same time, we're battling nutritional deficiencies. We're battling all those types of things. All that stuff factors into it. So, that's why one of the general increasing trends within the functional community is that the belief is that most people actually probably are functioning at about a 50 or 60% efficiency level. And that goes along with aging, right? If you think about the human body should last about 140 years, and people, what's the life expectancy of, 75, 80 years of age, somewhere in that ballpark. You're in that 60% range. It sort of makes sense. Not that you're going to live to 140, but not that you really want to, but it's you see it. You can start to see the implications of their body not functioning optimally as far as that goes. And insulin resistance is just one of the factors that impacts most people in a large way as far as that goes. From my perspective, like people talk about, and sort of deviating a little bit, like people talk about cholesterol being that the bad cholesterol being the element that causes heart disease. From my perspective, I don't really believe that. I mean, I think in my mindset, that's a little bit of a misnomer as far as that goes. It's almost a sort of a narrative that makes people want to just put people on, pharmaceutical cholesterol medications. Because you think about cholesterol medicines, I mean, they've been around, 30, 35 years. We've been, in theory, been dropping the bad cholesterol for 30, 35 years. Has heart disease, the prevalence of heart disease, gone away? No, it hasn't. It's actually been even probably increased. Whereas based on my understanding now, what I suspect is actually happening is because most people have insulin resistance, which basically means they have an excessive amount of insulin free floating in their system. Insulin is a very strong pro-inflammatory peptide. And as a result, if you have it free floating in your blood system, what's going to happen? It's going to start to damage your vasculature. And when you damage your vasculature, your bad cholesterol, your LDL, now starts to come in and fill in those damaged areas of your vessels. There's your atherosclerotic disease. So, I think, the bad cholesterol that we call bad cholesterol isn't what kills you. It's when you combine it with inflammation of the vessels. And when you combine it with inflammation of the vessels, it becomes a bad mix. Now there are different variations of LDL, things like that. That's why people who have it's not, you can have a 25% blockage in a vessel versus someone who has a 75% blockage, and that person has 25%. If that cholesterol plaque fractures, there's your heart attack. It's based then where it varies from person to person a little bit is the composition of the cholesterol. Which one's more brittle? Which one's more friable? Which one's more likely to fracture or to rupture? That's where it generates your strokes. That's what generates your heart attacks, everything else.
Yeah. And with your functional medicine approach, you're trying to reduce those issues with it. So it's the overall approach and how you help patients is fantastic. Now, I want to talk about, from a stem cell perspective. It sounds like you're different in your approach and that you add some different therapies to it. So if I were to come into your practice and I have you going through your knee regeneration program, you'll do maybe stem cell injections. You can kind of talk to that, but you also mentioned that you did, some laser therapy. Can you explain maybe a little bit, if somebody's interested in a knee program, or it could be elbow, but if we speak about the knee, how is that approach in your practice different than a GP that they see?
So the standard of care for, like, say, an arthritic joint, right, or tendonitis is oftentimes a steroid injection, maybe in combination with physical therapy. Whereas from my perspective, I look at it from a base element. It's inflammation, and inflammation in general is the basis of a lot of disease processes. So you can have, say, an elbow issue, okay, and nothing anatomically wrong with it, but just inflammation in your elbow. You have to look at it from two perspectives. One is, okay, you have an excessive amount of inflammation in your elbow, and two, what's your inflammatory sort of water table? Right? There's always a baseline amount of inflammation in your body, or what we call oxidative stress. And so if you sit there and have an excessive amount of it for whatever reason, it just automatically elevates the inflammation that's in your elbow too, right? And so sometimes what I've noticed is when I drop the total body inflammation, even without treating an elbow or treating a knee, the discomfort goes away. But then again, you have also people who sit there, okay, I was a runner for 30 years and I have bad knees. You just have bone on bone problems. Then what I do is, I do a variation of what they call red light therapy. Most of the red light therapy that people are accustomed to are what I term as first generation. It basically is a specific wavelength of light or multiple wavelengths of light that fall in that red or near infrared type range. And basically, when you look at medical literature and the benchmark research they've done on it, it pretty much tells you, okay, what does it do? The body will absorb that energy and actually activate what they call cytochrome C. So basically, how to activate your body's natural healing cascades. And so when you activate natural healing cascades, you can naturally decrease the inflammation within whatever you're trying to treat. So, I use this type of therapy on knees, elbows. People who have like spinal stenosis, you can take out most of their pain for them without ever injecting them or doing anything like that. And because the process involves your natural healing cascades, it actually is quite long lasting. I think the first time I did it probably 4.5 years ago, on a person with spinal stenosis. They had multiple back fusions. They had a cage back there. They couldn't sit in a car more than 5 minutes without pain. And within 1 week, I had her driving to her at that time, her son's college, which is an hour away without pain. it can be done. The greatest mechanism, greatest pathway is using your body to do it for you. Now, obviously, if you have an amputation or something like that, you're not going to fix that. But if you sit there and you have normal cervical neck arthritis, you have lower back arthritis, you have even acute injuries. Like I had a friend that had an Achilles tear, and normally when you recover from that, if you run an ultrasound over it, you'll see like a callus formation over it. And what I did with him was I treated him with my light therapy, and then I did put a PRP injection into it. And to my amazement, actually, his physical therapist who did the ultrasound on it said there was no callus formation. He healed like it looked like regular tendon, because you accelerate the healing process. And when you accelerate the healing process, you don't allow the different unnecessary layers to form. You just sort of reconnect as far as it goes. Yeah. And so again, if you study most of the medical literature is on first generation light therapy. But from my perspective, I tend to do more what I consider second generation. The difference is it's much more powerful. So I can go through your spine. That's how I do your backs. I do the work on like spinal stenosis. I do things like that.
Yeah, that's incredible. If you can help spinal stenosis, especially with a woman that had a cage placed in there with a fusion, there's really not many options besides a pain implant or just deal with it. So that's pretty incredible.
Right.
Yeah. One of the big, words that are out there today is peptide therapy. What are your thoughts on peptide therapy?
So, I think there's a distinction between, and it's sort of funny because like there's a lot of peptides out there, some of which are still in the research arena. So I can't really prescribe it for anyone legally as far as that goes. But it's funny, like I have patients who I just bought it online. They'll buy certain things, but I can't actually dispense it for them. Now, do I think they work? Yeah, I do think they work. I think they're is there a need for certain ones? Probably not. But definitely when you get into like BPC 157, you get TB 300, things like that, things that stimulate your natural body's healing mechanisms. I think they can be very, I don't think they're primary treatment typically, but they can be a very good adjunctive therapy for things, especially when you combine it with different other types of regenerative type things and nutritional support and all that kind of stuff.
Yeah. Have you noticed, Dr. Sheen, an increase in people asking, like, even though you probably haven't been self-promoting enough, are there people coming to you or even in conversation where there's more of a demand for functional and regenerative medicine in today's society?
I think what was interesting was when I first started really putting it out there, I always was under the impression that most people understood the term functional medicine. What I'm finding is most people don't have a clue. They've heard the term. They don't understand what it means. Now, that being said, I think they are looking for it because I have so many people I know that are like, I don't want to take. I would love to get off of this medicine, that medicine, whatever it might be. I wish I was feeling better, less brain fog, all those things. But my primary doctor says there's nothing wrong with me, but they don't draw the connection between I can fix that and the term functional medicine. Because there's a disconnect there in terms of that connection. I think if those people understood what it would be, what functional medicine actually was, and how it actually correlates directly with what they're looking for, they'd be searching for it all day long. But I think people struggle with not understanding that connection, and so when I start to talk to them about it, almost the very first thing I say is like, okay, yeah, we do functional medicine type things like that. Do you understand what that is? It's like, I've heard of it, but no, not really. And then I start to explain it. Then it starts to make sense for them. Then you see their ears perk up and everything else because it starts to match what they're looking for.
Yeah. So that brings up a question about the business itself and potential challenges. So there's a challenge in educating patients is what's going on. But do you have challenges in the business as you approach trying to see more people from a functional medicine or regenerative standpoint?
My challenge is basically I like to talk too much because I'm a big believer in educating people. And when I get into that, I tend to, my internal clock tends to be lost, and I tend to just, next moment I hear knocking on my door, it's like, okay, next person, that's one of the challenges I actually have. My staff will tell me, you need to sort of shut up a little bit and be quiet a little bit more, and and explain a little bit less and try to do certain things, just try to get it done. But I want people to realize, like, from my standpoint, if I have a medical condition, I want to fix it. I don't want to just take a pill for it. But at the same time, I want someone to listen to me as far as that goes. Because I'm sure there's a lot of people out there, especially now that, when you look at like primary care doctors where they have 5 minutes to spend with you, they're not people, they can't listen to you. You've got to listen to the person, get their background, get where it came from, the timing of things, how it all played out. So in your mind, at least from my perspective, I can figure out, okay, this is new, something changed, what correlates with something changed, and that starts to paint the picture for me and what I need to start targeting as far as that goes.
Okay. In the next 6 months of your practice, what are you focusing on?
I'm focusing on developing my functional practice. Because we're, the battle is marketing that information out that we actually do these things. I mean, like I said, I've done vein treatments for so long. Most people know us for veins. And so most of our clients are along that arena. But I like to bring in new clientele that basically is more in that functional arena aspect of it. But again, when you get into a lot of marketing now, a lot of it's social media. And you're very limited, because we're a medical office, you're very limited in what you can say, what you can post, because I've had people sit there and I'll post certain things and people say, well, you need to do before and after. Is like, I can't, without violating certain, Facebook rules or Instagram rules or whatever it might be. People don't really realize that, take it from someone who's actually been kicked off of Facebook. I'm sort of cautious about doing that.
Understood.
So yeah, and especially when it's not my area of expertise by any stretch of imagination, it's hard for me to keep up with all the new, updates in software, Google or whatever it might be. It's just hard to do that without knowing what's actually going on.
Yeah. Well, I'm sure you'll figure that out. From a patient impact and outcome perspective, I guess I'll ask this question first. What are you most passionate about in helping patients overcome their illnesses or their chronic disease components?
One of me, it's always you always take pride in the fact that you can actually help someone. Why do you think you get into medicine? To some degree, you get into it to help people. Yeah. And I think in my mind I've recalibrated what I look at as helping someone. It's not just, okay, I'm going to give you this pill. Now it's about trying to stabilize you, right? Or to fix the problem. Again, prime example, like I said, I've taken on an Alzheimer's patient, and I caught her relatively early. I mean, she wanted to do all of the traditional Alzheimer's treatments, which really you're sort of limited as far as that goes. But within the first year and a half or so, when she was doing that, you saw the tremendous deterioration in terms of what she was at the beginning versus where she was at that point. If I remember correctly, she was like 110 pounds starting, and when I got a hold of her, she was about 80 pounds. And that's when her husband actually reached out to me, asking for, what else can we do? Because they're already doing all the traditional medicine type of things. And so they obviously bought into it because there was no cure for it. So at this point, I've had her for probably 6 months now. She's up to about 105 pounds now. Her mental capacity has not deteriorated at all. She still had, I think I caught her after she'd already sort of lost some of her short-term memory issues, but all of her long-term, everything else is still intact. Now, what confounds her issue is she also has a Parkinsonian diagnosis as well. So right now I'm sort of battling the Parkinsonian side of it, trying to figure out the appropriate dosing for her and things like that for her Sinemet and other symptomatic control. But I think a lot of the treatments for what I would do for like an Alzheimer's person and for a Parkinsonian type issue, because both involve neuroinflammation and tissue or brain tissue destruction, the more you can regulate that and stabilize that, the more you can stabilize the disease. You know, I may be wrong, but I think from my perspective, I probably to the point where if I catch you early, I probably can stabilize you from an Alzheimer's perspective, and keep you where you are without you seeing dramatic decline in your cognitive function and things like that. And you know, that's rewarding. That's, I mean, for me, it's also fun because it's like, what can I stop? You know, or even in my mind, can I revert? You know, potentially reverse you. Although, you know, I know that if I catch you too late, I mean, there's not enough neuro stem cells to regenerate your brain. Yeah, that, you know, there's no way to really completely repair it if you've had a lot of tissue damage. But that's why you have to catch these types of things early before you've gotten to that end stage. Or, you know, if you completely are end stage Alzheimer's, you can't remember your family members, I'm not going to be able to do anything for you. But if you sit there and you come in early, okay, just got a diagnosis, yeah, you probably could stabilize it. Because you look at how the medications that are designed or targeting Alzheimer's, they're not really targeting disease. They're targeting the amyloid plaquing. And the amyloid plaquing is what causes the damage, but you need to figure out how to eliminate the plaquing and how to mitigate or decrease the amount of production of the plaquing. And that's the treatment of it. That's the functional side of it. If you do that, you'll stabilize them.
Okay. This is a very broad question, but what does success look like for you, for your patients, regardless of their condition that comes in? So what is, from your perspective, myself, knee problems, back problems, somebody coming in with Alzheimer's, what is success in your eyes for patients in your practice?
The reality is I'm the mindset, I mean, the most people honestly have no clue. And that's not a bad thing. I think you bought into the narrative of certain aspects of medical practice and medical and diseases out there, whether it be acute or chronic in nature. I think from my standpoint, I look at success in my mind as being people who have treated, understanding now that there are actually alternatives to what modern medicine actually affords you. There are actually potential solutions for things that you maybe thought were never going to be solutions for. And that goes into cancers, that goes into autoimmune disease, it goes into almost every chronic disease or every disease process out there. Because if you really get down to the crux of what's causing them, I guess the mark I want to leave is like fixing some of it, right? Giving people the hope that you can actually fix certain things. Because you think about, like, you look at Alzheimer's, if you can stabilize that person, just like what we've done with like HIV and everything else, it's a game changer. And then as a result, then you take away all the psychological stress people, the family members have, and all those types of things. It just goes on and on and on as far as it goes. You know, I would love to sit there and get the word out that, hey, yeah, if you have type 2 diabetes, it's reversible if you really want to reverse it. And because you think about, like, people ask me, it's like, well, why don't they fix it then? Because diabetes by itself is like a $250 billion industry. But if you start to relate all the side effects that come along with it, all the vascular disease, all the kidney problems, all the eye problems, and, you know, everything else, it's probably a $2 trillion industry. They're never going to fix it, right? It's too much money involved. Even though it's to the betterment of society and in the best interest of everyone out there, unfortunately, it's all about money.
Yeah. The end of your answer there speaks to your integrity and your ethics. You are in it for the best outcomes for your patients, and I think everybody goes into practice with that purpose, but not everybody knows that how you can make a difference. And you know, we can only make this much, but this much is better than not making much at all. So it's a great, especially if you can stabilize people in those conditions. I love that. Yeah. So from your business, your practice, what's the vision for the next 5 years?
Like I said, I mean, from a vein perspective, honestly, if I've done so much of it, it's not really a challenge for me anymore. Because I do look for, I do look for the challenge as far as the new territories, new knowledge, I'm always looking for new technologies. Because there are a lot of people way smarter than me developing all these new technologies as far as that goes. And then ultimately integrating AI into things and things like that, because you can take it a long way as far as trying to help people medically and doing all that. Now, where do I see us in 15, 20 years? I mean, 20 years, I see myself retired probably. But ultimately, I would love to sit there and down the road bring my kids into this and let them do that too, and teach them and sort of pass that along to them as sort of like I wouldn't say a dowry or type thing, but it's definitely because I have a few kids I have 4 kids in total, and I've 2 of them have verbalized interest in going to the medical arena, and
Nice.
and so it's like I said, take advantage of what I know. I mean, I'll teach you, right? I mean, I'll teach you how to think and how to process certain things and how to approach certain things, because it changes how knowing what you learn in medical school and residency. It's a completely different mindset. It's a completely different mindset in terms of how you would approach things, and it's a very fun and very challenging type of. And I just hope that society eyes are open to it and receptive of this type of information, because I think it's a game-changing information. May not be good for pharmaceutical companies, but it's really good for people in general and their general health.
Yeah, pharmaceutical companies have made their money. That's for sure. They'll continue to do so, but I think having the patient come first is important. So this is a time for you to brag. What do you feel that you do better than anybody in your community?
I think, not obviously I can't speak for everyone. I don't know everyone, of course. But what I do see is like one of the things that can become a very, I guess you could say it's when you look at like functional medicine, I sort of alluded to it earlier. There's a lot of different people who do functional medicine. You have your chiropractors, you have your naturopaths, you have some medical doctors, DOs, you have nurse practitioners doing it. Knowing what I know in terms of how much I've had to transition from based on what my existing medical knowledge is to even practice functional medicine, and to the depth of knowledge you need to have to again, you're thinking more on the cellular level, you're thinking more along those at the microscopic level, how uniform functional medicine services actually are, because like I said, my wife has a chiropractor she goes to, and he was offering her functional medicine services, but I could see his functional services are completely different than mine. His are more just again supplementation, things like that, whereas mine is more geared towards specific physiological details. Now, how many people out there who practice functional medicine process the information to that degree or to that at that level? I don't know, but my suspicion is that it's probably not that prevalent. But I'm hoping that that's not the case, because I mean, even if I wanted to be ultra busy, there's no way I can handle everyone anyway. I mean, even I live in St. Louis, and I live even in the middle of town. It's a primary care shortage, right? No one wants to practice that type of medicine anymore, and so you need that gatekeeper, that person who's going to take care of people.
Yeah. Well, I love that answer. I'll share all of your contact information here, but how would you like people to reach out to you if they're interested in learning more about you and your practice, Dr. Sheen? How can they get a hold of you?
Well, I mean, you can go the first thing you can do is just visit our website. It's www.sheenveincosmetics.com. We actually go by 2 different names. We go by Sheen Vein and Cosmetics, and we also go by Sheen Vein and Aesthetics and Functional Medicine, because we really have developed 2 different sides. And so just try to reach out to us. We have the contact information, everything else is on there. If you are in St. Louis, or even if you want to do functional medicine or would like to have functional medicine type services, give us a call. We may be able to help you as far as that goes. and offer you some advice as far as what might happen.
Yeah. Thank you for that. As I wrap up here, is there any last parting words? Did I miss any question you wish I would have asked? Or is there some words of wisdom from Dr. Sheen as we close this out?
My advice to people is keep your mind open. Because again, when you talk about, I understand people are battling what mom told them, what dad told them. And that information isn't, especially when it gets to medical type information, isn't always accurate because they're probably relaying what they've heard from other people, but not all of it is based in medical literature, not based in science. Like I say, even when you get to vein problems, most people look at spider veins as a cosmetic problem, but at the end of the day, your spider veins carry blood. I mean, how it just conceptually, how is a defect in something that carries blood ever cosmetic? It'd be like saying if you have a defect in an artery in your finger, that's a cosmetic problem, but a defect in the aorta of your heart, that's a medical problem. One's obviously going to kill you versus the other one, but the reality is both are problematic. And so when you get to functional medicine, the important thing is keep your mind open, because there are technologies out there. There are the little caveats as far as how physiology works that most people don't actually understand or think about. And your doctor's not going to think about it either. I know that because I was trained that way. You don't think about it at all. Unless you're taking a board exam or something like that, you're really not thinking about it. And let alone incorporating into how you actually practice. Because that's, at the end of the day, I think once you start to realize most diseases are either inflammation related, they're either mitochondrial dysfunction, oxidative stress related, and then again, you have the insulin resistance component of it. I'm sure I'm forgetting things, but the reality is they are big cogs in the wheel as far as why we have sort of the poor health outcomes we have here. It's just not addressed the right way.
Yeah. Well, Dr. Sheen, I appreciate everything that you shared with us today. This is an easy job for me because I get to learn from people. I get to learn from some of the best in the field. So I really appreciate you being an internal medicine physician, learning, becoming the leader in your community that way, and knowing that you want more. Just as you said, be open. You were open to wanting more. And the important part for people when they listen to this is, we would like this information shared, not necessarily for our businesses, but because there's someone that's going to listen to this or watch this, and they have a friend that they had coffee with, or they have a relative that they were talking with over a holiday, or somebody that can benefit from this. Now, whether they call you or check out your website, that's what they need to do, because you just as you said, everybody has to be open to the possibility of getting better. And there are too many great providers that are out there that aren't seen or aren't heard. So I appreciate you sharing that with us today. So if you can, reach out to Dr. Sheen. If you like this podcast today, please share it across the board. If you want to, subscribe to this on YouTube or on our channels as well. But until next time, remember that wellness is a journey we are all on together. Now, whether you are in charge of your own health or guiding others in theirs, every step forward really, really matters. So do what you can to take care of yourself, and please do the best you can to make sure you have prime health in your life. Thank you again, Dr. Sheen. I appreciate it.
Thank you, Derek, for having me.